Hello, this is midwife Jenny Joseph with Common Sense Childbirth, and I'm just making this little video to give a little bit of an encouraging word to all of you out there who are struggling right now. I am a midwife. I've been a midwife for nearly 40 years, and I have a lot of experience when it comes to working with women, especially women in the community. Right now, the COVID-19 pandemic has all of us completely overwrought, overwhelmed, scared, and at sixes and sevens, as we say in the United Kingdom. I want you all to stop a minute though. Let's take a deep collective breath. Let's remember how we center ourselves, center each other. And in this case, I'm talking about centering the mother-baby family. Let's get ourselves together here and calm down a moment and make a good and solid plan. So many of the moms are hearing that they can't bring more than one support person in labor in the hospital, sometimes two. But what an awful place to be, to have to make a decision, to have to choose between family, loved ones, doulas, and supporters. So how about this? Regardless of what plan your hospital has in place for you, you can make a plan for yourself. Be prepared. Even if you've been told you may bring your doula or your midwife can assist you in the hospital, just be prepared. Know that you may still find when you reach there that they changed that plan, they changed that policy, and no, you can't get in. This is not a time to be spending being frustrated, angry, frightened. If you're thinking ahead, you can be ready. So plan ahead for the possibility that no matter what, you may be separated from your doula or your midwife at the hospital. Work out how you guys can stay connected via your cell phone. Keep a cell phone extra battery pack already charged. Have your charger in your birth bag. Make sure that you are able to either do FaceTime or Skype or Zoom. Practice now. Reach out and get your plans in order so that you are not blindsided or surprised when perhaps what you thought was going to be is not. These are the times that we're living in. Doulas, let's look at this. Let's be really proactive in how we provide support. We do not want to pull the rug out from underneath our families, but at the same time, our hands are tied. So consider that you work with your families, work with your moms and dads to know how to reach you 24/7 via the cell phone, via the laptop, emails, however you guys work it out, but you can still support even if you're not able to be physically present at the delivery. Also find out about hospital policies for postpartum and lactation support. Make sure that you at least have all the resources available that might be available for your clients so that they are going to be as prepared as they can be. Remember, COVID-19, at least as far as the evidence shows right now, is not transmitted to the baby while in uterus. Moms, stop worrying about the baby and worry more about yourself. I know that's completely opposite to how we operate as mothers, but this is the time to really figure out that to protect yourself and your family is first and foremost your work. Do that first because your baby is safe inside you. If your baby is born, you can breastfeed your baby, but again, the onus is on you to protect yourself so well that you are protecting your baby at the breast as well. Follow all the guidelines. Pay attention to what they tell us. At this point, this is all we have. For midwives, I've found in the last week, I've had to do all of my patient care via telephone or telemedicine. It's been a real experience, but one thing is staying the same. When we reach each other, mother, baby, family, midwife, doula, we all feel better. Let's make plans so that we can stay connected. I have a model of care, I call it the JJ way, and there are 4 main tenets, and I want to share them now. The first one is always access. So this is about finding ways to have access to each other no matter what the circumstances. The second one is connections. Clearly, we must stay connected to be able to manage and survive this. The third is knowledge. Find out everything you can right now before you need the information. Get to work. And lastly, empowerment. You will be empowered when you feel you have a little element of control over some things. No, you won't have control over everything. We are in a pandemic, but at least you have power over what you need, what you know, who you love, and how you're going to operate going forward. We'll all be empowered if we take a little moment, take a deep breath, center ourselves, center each other, take care of each other, and we will survive. We will prevail. Thank you for listening. I'm Jenny Joseph.